Please welcome to the stage Dr. Chelsea Clinton.
Goodness, thank you so much for joining us for this important session where I'm really excited to hear from so many people working on so many urgent issues, all with a real, not only focus and commitment, but centering of equity. At last year's CGI meeting, as those of you who were with us will remember, we were incredibly honored to be joined by His Holiness, Pope Francis, in a conversation with my father, in which they discussed kind of many of their shared areas of real kind of purpose in life, including as it relates to protecting and promoting children's health and well-being. And so this year, we're really honored as a continuation of that conversation to welcome the patrons of the World's Children's Hospital, or the Pope's Hospital, back to CGI. And to share more about their work and what they've been doing over the last year, I want to welcome our friend and CGI partner, Fabrizio Benvolio, to the stage to tell us more about what they're doing to try to help ensure that every child gets the health care that all children deserve. Fabrizio.
Thank you, Chelsea. I am honored and privileged to be here today with you. You mentioned last year conversation between President Clinton and the Holy Father, and in that conversation, I remember the Pope spoke about children. And I'm here today to tell you a story of a young girl I recently met. Her name is Cecile. She's 12, and she suffers from a respiratory disease. Quite serious, but treatable. She can be cured in our part of the world. She lives in a small village in the Philippines, and there things are a little bit different. For weeks and weeks, I begged her mother to allow us to bring her to Rome, to Bambino Gesù, the Pope's hospital, to treat her, to get access to the best possible care, the best doctors, for free. And she refused because it's a long trip, and I understand that embarking in such a venture with a sick daughter is threatening and frightening and very intense. It is a painful, hard truth that a lot of children suffer and die with their life unlived. And there are a lot of children in this situation. I'm thinking about the children of war, and we know how many there are around the world. I'm thinking about children suffering from the consequences of natural disasters and other reasons. But for many of these children, there are already organizations that are trying to take care of them. And I'm thinking about governments, the WHO, the UN, private and public foundations. And then there are hundreds of thousands of children that are on nobody's radar screen. They are invisible and have no safety net. They die from preventable and treatable diseases that are very simple to address here in the developed world. And this is the reality that I'm trying with my partners and friends to address to help the most vulnerable. My name is Fabrizio Bentivoglio. I'm the president of the World's Children's Hospital, a not-for-profit organization trying to create a system in a sustainable way to support and treat the most vulnerable, suffering children. How are we going to do that? We had developed a hub-and-spoke model based on a digital platform that has been developed to address this issue and connect the best institutions in the Western world to provide healthcare, training, development to doctors, nurses, medical personnel, telemedicine, teleconsultation, and provide this to a network of spoke hospitals, clinics, health centers in the regions, in the developing world, in Africa, in Asia. And these are the institutions, the hospitals, the clinics that treat hundreds of patients every day. And we want to develop a system that can sustain itself and develop local capabilities and knowledge. Because like Cecile, these children deserve the right to be treated at home. With the blessing and the support of Pope Francis, with whom I met last week, I'm happy to launch today with you the Pope Francis Global Alliance for the Health and Humanitarian Care of the Children. The Global Alliance will leverage the extensive global network of the Catholic Church to go and find those children in desperate need. Because as Pope Francis said, while there are incurable diseases, there are no incurable children. Pope Francis has encouraged us to be close to those that suffer and to listen to their voices. And the Global Alliance is the response to this call, but we want also to have an action plan. In fact, we aim to help approximately 500,000 children and their family by the year 2027. And I'm humbled here today by the willingness of and the expertise of my partners of the Global Alliance and CGI to join me in this endeavor. And I hope you too will join us, because I am strongly believing that together we can make a real change for those that suffer the most, the children. Thank you very much.
Fabrizio just said to me, I know you're a mother, so you can relate. And while that is certainly true, as I think about the strep infection that my daughter got on her 4th day of school, which, yeah, thank you, but it also felt like it shouldn't have been, I don't know, at least 2 weeks in. Deeply mindful both of how grateful we are to live in an era where we thankfully still have, for many infections, functional antibiotics, and also deeply mindful of so many people around the world who don't actually live in that era. And you also shouldn't have to be a parent to care about our most vulnerable, including our children. So now, with enormous gratitude to Fabrizio and everyone who's committed to bringing the best quality care to children around the world, it's now my honor to welcome the following commitment makers to the stage, as I am lucky enough to share some of the work they're committing to do as it relates to cancer. So please join me in welcoming the following to stage. Camilo Arazo of the Health Foundation, Isabel Mestres of the City Cancer Challenge Foundation, Sumera Haq of the Anissa Foundation, Nikhil Bhakta of St. Jude, Emily Smith of Duke University, and Urchana Shrita of Kathmandu University. Yes, please give them all a round of applause. It is often said that cancer doesn't discriminate, but yet, of course, it does. Certain populations are disproportionately at risk. Certain people, depending on where they live, are disproportionately at risk. And certainly not everyone around the world has access to the care that Nikhil's colleagues provide at St. Jude. And so their collective efforts will make strides towards democratizing access to earlier diagnosis, earlier intervention, and then thankfully more effective treatment, especially with a focus in low and middle income countries. So Duke University and St. Jude's Children's Research Hospital have teamed up to create a comprehensive program to bridge gaps in access to cancer care for children in Asia, Africa, Latin America, and the Middle East by 2031. The program will initially connect 5,000 families with a patient navigator to help them manage their child's care by offering support around things like scheduling and attending appointments and navigating and completing paperwork. Additionally, and I think this is really an important point, a cash transfer program will provide these families with $1,000 for them to use as they see fit to offset the cost of caring for a child with cancer. Please give them a round of applause. The Movement Health Foundation is committing to dismantle barriers and advance gender equity in healthcare by using cost-effective technologies to help with the early detection and diagnosis of breast cancer and cervical cancer in women in South Africa and Peru. In South Africa, women will have access to information on cervical cancer and the screening process from a user-friendly web app. In Peru, Movement Health will adapt a proven digital application for maternal and newborn health to women's cancer care. Movement Health aims to reach 50,000 people across both countries with this commitment. Please give them a round of applause. The City Cancer Challenge Foundation is committing to strengthen gender-responsive care for the 3.8 million women living in Leon, Mexico, Nairobi, Kenya, and Tbilisi, Georgia. They'll do this by prioritizing women's unique needs in cancer treatment, training health professionals to provide gender-informed and gender-responsive care, and to help advocate for cancer services that center women's physical, mental, and financial health. City Cancer, oh yeah, thank you, the woohoo, I appreciate that. This can be interactive. Through this work, City Cancer Challenge will decrease the risk of negative outcomes and certainly save lives. They hope to scale this commitment to their full network of 15 cities worldwide by 2030. Please give them a round of applause. The Anisa Foundation is committing to establish 4 women health empowerment centers that will serve 50 rural communities in Pakistan. Yeah, this can be responsive, thank you. Operating out of climate-resilient community spaces, these centers will employ 120 healthcare workers to provide women with outreach services like health education, encouragement in seeking screening and care, and assistance in utilizing health services to increase early detection and effective treatment. By offering support throughout the entire cancer continuum, from education to screening to treatment to survivorship, the Anisa Foundation aims to empower 50,000 women in Pakistan to take control of their health and their care that we all deserve by 2028. Please give them a round of applause. Dulikhel Hospital, Kathmandu University, is committing to scale cervical cancer screening and treatment in Nepal with the support of an AI-powered app that can help improve accuracy of diagnosis, provide real-time clinical decision-making support, and support patient follow-up care. Leveraging digital innovations and tools, this commitment aims to double Nepal's cervical cancer screening rates to reach 302,000 women over the next 5 years. This tech-enabled approach to cervical cancer will no doubt lead to earlier diagnosis, better care, and consequently save lives. Please give them a round of applause. And certainly, I hope, and I know this will sound familiar to those of you who have heard me speak at podiums like this, for any of you in this audience who feel like you would have something to contribute to these commitments, either financially or with your own kind of hospital networks, with your own digital health solutions, kind of with the ecosystems in which you kind of operate every day, please reach out to them. Their collective work will clearly make a substantial dent in the inequities that too often are the face of cancer care in our globe, but we know with ever more partners and support, they could do even more. Please give them collectively a round of applause. Now it's really a pleasure and honor to introduce someone who has spent her entire career in an effort to expand access to quality healthcare services and to improve patient and population health. What started off in her own home country, now thankfully, are a set of qualities that we are lucky enough to benefit from at a global level. Please join me in welcoming the new and very thankful that she's in this seat, CEO of Gavi, Dr. Sania Nishtar.
Thank you, Chelsea, for that kind introduction. It's great to be here at CGI after quite some time, and thank you for all the work you do to continue to inspire us. I'm here to talk about immunization as the new CEO of Gavi. And I think it's a very auspicious occasion to talk about immunization because as we speak, we're celebrating the 50th anniversary of the expanded program of immunization, which has helped save 154 million lives worldwide. 154 million lives. We all know that immunization is one of the most cost-effective interventions in the health sector. We know immunization saves lives. And we know immunization delivers real value for communities and protects people. But the real value of immunization can only be gauged when you see a child convulsing with malaria on the bedside. The real value of immunization can only be assessed when you're in a disaster situation, post-flooding or post-earthquake, and you see hundreds and thousands of people suffer from cholera needlessly. And you appreciate what immunization can deliver when you're on the bedside of a child who's taking his or her last breaths because of pneumonia. Like many of you, I have been on the front lines of medical care in one of the most disadvantaged settings and have seen this play firsthand over and over again, which is why I'm so humbled to be standing here as the new CEO of Gavi. Gavi essentially is an organization which was structured as a public-private partnership back in 24 years ago. And since its creation, Gavi has vaccinated over 1 billion children. It has saved 17 million lives in the process. And it is not just lives saved and disease averted, it is also a significant economic benefit that the organization delivers. Over the last 24 years since its existence, Gavi has accrued over $200 billion worth of economic benefits. And it does that with a very low operational cost, with less than 3% operational cost, and with sustainability hardwired into the design. So when we start working with countries co-pay, Gavi co-pays, and over a period of time, countries graduate from Gavi's support. So it's a very sustainable model, a model that delivers. And I'm very pleased to let you know that over our next strategy period, which starts from 2026 and ends in 2030, we will be accelerating our work. The last 1 billion children were vaccinated in over 2 decades, and the next 1 billion children will be vaccinated in half that time, In the process, we will save over 8 million lives and accrue an additional $100 billion of economic benefits. And it is not just childhood vaccines that we are doing now going forward. We are also we are also deploying vaccines like the HP, the human papillomavirus vaccine, preventing adolescent girls against cervical cancer. We're also playing a very proactive role in global health security. And as we speak, I'm very pleased to let you know that we have ordered the largest assignment of Mpox vaccines to date to battle the Mpox crisis in Western Africa. And of course, there are new vaccines like the malaria vaccines, which are groundbreaking for the African continent, which battles with more than 600,000 deaths, most of them deaths of children. So we are significantly enhancing our work, significantly accelerating our work, and really look forward to your support as we move into our replenishment cycle. Replenishment is our parlance for fundraising for our next strategy cycle. We have an ask of $9 billion. And we've made a very good beginning with the government of the United States pledging $1.58 billion as we kicked off. Very grateful for their support and look forward to continuing building further this relationship. And I just want to say in conclusion, because CGI has been such an inspiration for building partnerships globally, I just want to recall today that the success of Gavi is rooted in its very proactive approach to building partnerships. We are, to begin with, an entity which is called an alliance. So the World Health Organization, UNICEF, and the World Bank are an alliance partner, and we execute through them. We have very positive relationships and very proactive partnerships with donor governments who've helped us to vaccinate over 1 billion children and will continue to stand with us as we vaccinate the next billion. And then, of course, the partnerships with implementing countries are key because it is their systems that we leverage to deliver. Partnerships with other delivery organizations such as the civil society, humanitarian actors, innovators are also key. And I would say, importantly, partnerships with the private sector, in particular the pharmaceutical entities, has been key to Gavi's success, because through these relationships, we have been able to bring forward innovations, we have been able to make price accessible. And just to give you an example, it takes about $1,300 to vaccinate a child fully in the United States, and in Gavi-supported countries, it takes around $25 to $28. And the price advantage, the access advantage was enabled because of our very proactive relationships with the private sector. And of course, our commitment to partnerships doesn't end there. The organization has very proactively partnered with the private sector and the development finance institutions. We float a vaccine bond, for instance, to front-load financing. For instance, we put out their advanced market commitments, which enable us to further our goals. Just this morning, we had a donor liquidity agreement with the United States DFC, and very grateful to their support, and we're expanding our partnerships with other development finance institutions. So just in conclusion, to reiterate and to emphasize, immunization is important. We are accelerating our work. We are really grateful for all the partnerships that we've forged to date, and we really look forward to the CGI community to be our champions. Thank you so much for having us here this morning.
Please welcome to the stage Andrew Jack, Financial Times.
Perfect. Well, thanks very much. Welcome, everyone. So I'm Andrew Jack from the Financial Times. Now, amongst my portfolio areas is education, and one thing that particularly interests me is the impact and responsibility of academic and scientific research that engages with societal value and the intersections with companies and philanthropy, as well as governments. So a great panel for us today to discuss those issues framed around the question of health equity. So let me introduce Raj Shah, the head of the Rockefeller Foundation. And Noubar Afeyan, the head and founder of Flagship. So welcome both. We're going to talk about a whole range of issues, including, of course, climate and nutrition, AI and technologies for transformation, and that core issue of equity and access. But maybe just for anybody who's not familiar, I might just ask both of you a kind of framing question a little bit about your organizations. So Noubar, just tell us a little bit about Flagship and its role in the ecosystem, and perhaps one or two of the key areas that you're most proud of recently.
Sure. Well, thanks for having me. So Flagship Pioneering is now nearly a 25-year-old organization. We're based in Boston, Cambridge, Massachusetts. And we are an unusual enterprise in that our product is companies. So we conceive and create scientific companies that impact human health and sustainability. And over the 25 years, we've been the founders and developers of some 110 companies, of which the 18th one, we number them when they're born, became Moderna. And so Moderna is a company in which I, as well today, act as founder and chairman. And Moderna, of course, in addition to the fact that it had the opportunity to have impact at the planetary level, is just one of the many bioplatforms that we have brought to life. And so that's what we try to do, is to identify things we think that 5-10 years out, maybe sometimes longer, will be needs which will require scientific solutions that are not adjacent to the present state of the art in science, in academic science. And we try to leap to those opportunities and see if we can reduce them to practice sooner than the 5 or 10 years it might take to get there naturally. That's our methodology. We practice it with a team of about 500 people. And every year we launch out of this process 6 to 8 new biological platform companies. Most recently, Andrew, the areas that so we work a lot in the therapeutic vaccine diagnostic area, but also we work on agriculture and the use of life science to impact both food security and climate. And in that area, we have some very interesting innovations we can talk about later, but also more broadly, the impact of generative AI over the last 5-6 years in our own laboratories has also been quite profound. We're able to create de novo computationally generated biological molecules that so far, in just one instance, the company called Generate Biomedicines has developed 12 new antibody-based drugs, or potential drugs, of which 2 are in human testing. Just today, that company announced a major partnership with Novartis, having had one with Amgen. So these are things that are completely new capabilities, and we'll talk about how these cutting-edge things impact health equity and how they address some of the worldwide challenges, not just in the extreme cases that they may be applied in the US, but certainly the capability development and the convergence of technology from the computational world and biology understanding is what we're specializing in and trying to have impact through.
Thanks. And Raj, of course, Rockefeller Foundation, very well known. You've somewhat pivoted the organization to focus a lot, for example, around the issues of energy, haven't you? I mean, maybe there's some people who are kind of concerned that it's leaving behind a little bit some of its historic role around health. What would, give us a sense of the prioritization and the sort of resources now that you're putting into these different areas?
Sure. Well, first, it's great to be with you, Andrew, and it's really an honor to be with Noubar. I'm such a huge fan of Flagship and the model you've crafted and the impact you've had. It's extraordinary. We all owe you a big thank you. I'd say, yeah, that's fine. As a customer, I'd say thank you. The Rockefeller Foundation has been around, as you know, for more than 100 years, and it's founded on a very simple idea that science and innovation should be applied for the uplift of all of humanity and not just for those that have immediate access and the means to access those innovations. And a long time ago, that meant bringing science and the discipline of scientific inquiry to medicine and public health. Then it was doing the same with agricultural research that led to a green revolution around the world. And we really do believe the next big frontier is bringing energy innovations to the entire planet. There are still more than about a billion people that live with effectively no access to electricity whatsoever, no level of power that allows for human productivity to rise and therefore uplift their communities. And there's another 2 billion people on top of that billion that live in economies where their primary constraint to growth is the cost and reliability of electricity. It's usually backup diesel generation, which is dirty and extremely expensive, and it just strangles their ability to lift up their human condition. So energy is a huge area of focus for us. We've built, if Noubar says his product are companies, our product are partnerships. And we built the Global Energy Alliance to reach 1 billion people with renewable electrification. I'm happy to talk about. But we also remain deeply committed to food and to health. And we do that because at the end of the day, we all know, and we're here to discuss how the scientific frontier is making new knowledge applicable that can lift up everybody in those areas. So in food, for example, our largest domestic project is in the area of food as medicine, where we've supported through the University of Pennsylvania and a great scientist there, a nationwide series of research studies that demonstrate how targeted food as medicine interventions, especially for pre-diabetic populations, can actually change the rate of long-term diabetic prevalence and save insurers money, save beneficiaries from negative long-term health consequences, and serve as a win-win, and perhaps even an alternative to some of the new Wegovy and other types of products that we're going to probably increasingly depend on as a modern society. In the health area, we continue to work on pandemic preparedness, now with a real focus on helping countries and public health systems around the world adapt their sentinel tracking systems to understand how climate change affects the shifts in disease prevalence and opening eyes to new types of consequences from heat and heat stress, including kidney diseases of unknown origin and some of the targeted consequences of heat in both rural and urban areas around the developing world.
Noubar, picking up on the pandemic theme, any lessons now from COVID-19, including, of course, there was huge debate, wasn't there, about pricing and access, particularly in lower-income countries, but also in various traditionally disadvantaged groups to have access to vaccines. What reflections do you have out of Moderna and perhaps that broader experience that we need to think about today?
Well, yeah, it will take us a few days to go through all the different lessons. And
give us two.
No, I know, I'm just kidding. So I'd say two things. One is that I think one takeaway should be that societal challenges that seem unsurmountable can be overcome based on science, technology, efforts that are coordinated and in a partnership way delivered for good in a fraction of the time people think is practical. What is disappointing about the COVID-19 experience is that happened in front of our eyes, and as a collective, governments, civil society, everybody wants to forget it as quickly as we can. And yet, that was a moment, not just our piece of it, but all the diagnostics piece, all the protective gear that was launched. I mean, humanity rose to the challenge, and an otherwise a virus that could have destroyed tens of millions of lives actually was held back, and we did that in a very short amount of time. So to me, when it comes to renewable energy, when it comes to carbon and climate, I think there's lessons to be taken, and an important one is the role, for example, in this country, that Operation Warp Speed played. It was also politicized, but the reality is, at least from my point of view, no matter how much money we had spent developing the platform of mRNA, which in our case was $2.5 billion, had gone into developing that platform that was poised to do this. It was not developed for this reason. And imagine how many other places such investments are made, like in medicine, food-based medicine, that we could know. Now, the key to OWS was that government said, we have a need for this. Whoever can come up with this need, here's a known advanced purchase agreement, a known price, and we'll help you cut through all the things that we need to do, but still you want to develop a safe vaccine, which was possible. So the alliance between the government, the NIH, private companies in our case, was really exemplary. And I think that we can have an OWS for carbon, we can have an OWS for nutrition, and I think we will. The problem is that OWS has been stigmatized, and so people are drawing all the wrong lessons from it. So that's an important thing as well. On the health equity question you raised, look, that was a really challenging thing for a relatively young, back then 12-year-old biotechnology company to be thrust into the world of people making demands that we should send them vaccines, let alone at different cost points. And the reality was that this was, in my view, the obligation of the governments to reach an agreement as to how supply would be distributed. And uniformly, they were unwilling or unable to do that. And instead, what they did is they put a lot of public pressure, and I'm not saying there wasn't some things we could do better, put a lot of public pressure that the company should do something. In fact, the companies had signed agreements, in our case, where 100% of all of our output had to go to the US government, and failing that to the EU, at a time when we were being asked to supply product which we couldn't do legally. So I realized in that whole thing that there's a whole nother political kind of dimension to this. And so what we've done since is we've set up the Moderna Foundation, we've done a lot of work in developing the access routes by which vaccines can get out. And look, the reality is, I was just meeting with colleagues at Pfizer this morning, they had the same experience. The reality is, between us, we destroyed more than 1 billion doses that we had committed to get to Africa, none of which was taken up in the end. There was a lot of there's a lot of access things we have to fix. There's a lot in which Rockefeller and others are doing. So I would say there's a lot we learned how to do better, and next time we will by having supplies ready to be deployed globally. We're building what we call resilience plants all over the globe so that they could very quickly switch production and not be beholden to agreements that are being forced on us. So I think it goes on all of us to learn from these things. I'll say one last thing. We talked about climate. I do worry that the climate change that we're incurring will actually bring about more serious health effects sooner than we expect that will feel like pandemics. They may be mini pandemics, but the effect in society will be equally debilitating, and I just don't think we're ready for those.
Yeah, Raj, so that intersection with climate, but also more generally in terms of how you're thinking now post-COVID about access and health equity, what's your priorities?
Well, I want to build on two things Noubar said. The first is we should have had an Operation Warp Speed for testing. And all of the Operation Warp Speed concepts, which are basically saying let's do public-private partnerships with a large-scale view to ensuring rapid access at a time of crisis, should have been global. And both of those things would have been eminently achievable. In fact, after the Ebola crisis, there were 4 major, this was in 2014, there were 4 major studies and reviews. I co-chaired one of them, but there were 4 major reviews. They all said the exact same things about what the world needed to do. And, depending on which line items of that action plan you chose to fund, it would cost the world somewhere between about $500 million a year to about $5 to $10 billion a year, depending on how much community delivery you were funding as part of that global resilience plan. None of it got implemented. Right now, as we sit here, foreign aid over the last couple of years for global health has actually gone down and continues to go down and get diverted. And because of some of the macroeconomic consequences of how we all responded globally to the economic crisis that COVID brought, developing countries are experiencing a net outflow this year of $50 billion of public funding, whereas 10 years ago, they were experiencing a net inflow of $225 billion. So let's just be clear. Right now, there are 40 countries spending more on debt service abroad than they are on building their health infrastructure at home and serving people. And so we have to reimagine our political cooperation and our aspirations to do what Noubar is saying at scale, seriously. And he's right that climate change is just going to make pandemics and things that are not technically pandemics that feel like pandemics far more frequent, and now we have to deal with it in a different kind of resource and a resource-constrained environment. The last thing I want to say is we have vastly underestimated the value of food and food safety net interventions as an underpinning for human health at home and around the world. The reason more Americans died than should have compared to any other country on earth was because we have an underlying obesity crisis in this country, and we were sitting ducks. We had a set of preconditions that made the consequence of getting COVID in the United States far more lethal than elsewhere in the world. And that is, at the end of the day, a function of our food system, our food policy, and the environmental context in which we consume food. And on a global basis, we continue to see these crises lead to huge bumps in infant mortality, child mortality, under 5 mortality. And we know that 65–70% of the vulnerability that represents is from underlying micronutrient malnutrition. And we've done very little to build out the safety nets in school feeding and infant and young child feeding and in dietary diversity for people that are sort of $5 to $7 a day and below. So it's not that we don't know how to bring large sections of the global population to a place of nutrition, health, wellness, and human aspiration that's better. It's that right now we're not doing it with our politics and our resourcing and our level of partnership.
Noubar, yes, picking up that theme of food availability, but also quality, the nature of the diet and of access. What are you doing in that space? I think we've talked about human medicine, but you're also active in agriculture. Yeah.
Well, we're doing two things, actually, along the lines what Raj described. One is that we know so much about how to develop medicines that we've now gone back into looking at the biochemical composition of foods to identify molecules that have essentially been consumed by humans for a very long time and identify in them specific signaling molecules that can actually increase health instead of decreasing and deteriorating health. And we're finding, using, again, AI is an amazing way. It's like if I was an archaeologist, AI would allow me to have like surveillance and deep scans in a way that there's no place to hide. Molecularly, there's no place to hide. Over the next few years, we will know every single component of what we're consuming and what it's doing and what pathways it's interacting with. And I suspect that there will be GRAS substances that will add significantly to a scientifically validated version of what we today call supplements, but that will actually have positive health effects. You can get it through the food, although you might not get the right concentration. So that's one way. And then on the agriculture side, we're doing quite a lot bringing these modern molecular biology tools to that space. We have developed across a couple of different projects I'll describe very briefly. One, a project called Indigo, where we're using microbes, just like we have in our guts, to change traits in seeds as seed coatings to be able to make much higher yields and drought-resistant versions of seeds. That company, in turn, is leading the way in using regenerative farming and enabling farmers to actually demonstrably, certifiably capture carbon, or at least keep carbon in the soil and generate additional revenues based on the offset needs that people are very much interested in. So we're doing the science and the actual quantitation that enables that. And already we have $30–40 million of such credits that have been used and the farmers getting the benefit of. The second area is that we're using some of the most cutting edge gene editing tools, multiplex CRISPR editing, have for the last 5 years, to develop what's very close to market, a generation of seeds that have the same traits or not better than what's the proprietary versions, but available much more broadly to the world at different cost points. So those two interventions are going to make a difference in food security, but also change the dynamics of the kind of way in which the ag industry works, which is very constrained as to where supply comes from.
Raj, we're almost out of time, but just briefly, great audience here. Just give us a couple of provocative challenges to them about what they should be thinking about. We talked about the challenges of the policymakers, the funding, initiatives, both at philanthropic levels and by companies. But what does this sort of broader community need to think about as we really try to focus resources and initiatives to improve human outcomes, essentially? And
human health. I would just take what Noubar said. The scientific frontier of human nutrition, from gut microbiome to understanding the consequence of micronutrient sufficiency in the pregnancy to 2-year window, to expressing and understanding the value of school feeding programs that today reach about 400 million kids, and even though the fact there's 700+ million kids in school that could benefit, and most of those left out are in very poor countries. And you can change people's food habits and understanding of food culture through that type of intervention. And regenerative agriculture, which has the opportunity to not just produce food that's more sustainable for our planet, but fundamentally more nutritious for consumers. Those trends connecting those trends to large-scale investments in safety nets in that infant and young child category for mothers in school feeding, and then ultimately more broadly for communities like pre-diabetic populations that have unique vulnerabilities. That's where I think we'll see the next big statistical transformation of human health and well-being. And my goal is to have more people see that connection across food, science, medicine, and health, and then apply it in a way where we learn from the lessons of COVID and we make the wins accessible very broadly to the world's most vulnerable communities.
That's great. I'm afraid we could talk for a long time, but no time now, but do please thank our great panel. Great, and now I'm just going to hand over to my fellow moderator for the next session, which is talking about antimicrobial resistance. So if I can hand over now, please, to Dame Sally Davies, who's the UK's Special Envoy for AMR.